suffering with SIBO or small intestinal bacterial overgrowth and looking for a permanent solution that does not involve antibiotics? In this video, I'm going to share the symptoms and causes of SIBO, the tests that can help you diagnose SIBO, and the natural remedies and nutritional tips that you can use at home that can help you deal with SIBO permanently. For the best natural healthcare advice and tips, subscribe to my channel and hit the bell icon so you get notified every time I post a new video on a Friday. Let's get started. For those of you who are not familiar with SIBO, let's first understand what is SIBO. SIBO stands for Small Intestinal Bacterial Overgrowth. SIBO can be associated with chronic digestive problems such as gas, bloating, diarrhea, or constipation. Bacterial overgrowth in the small intestine is thought to be a condition that may be present for years without causing obvious symptoms. Some of my patients who have SIBO have been told that they have IBS. It is estimated that 50 to 70% patients suffering with IBS also have SIBO. SIBO can also result in non-digestive symptoms such as lack of energy, chronic fatigue syndrome, fibromyalgia, allergies, arthritis, lupus, autoimmune disease, diabetes, and other chronic conditions. What are the causes of SIBO? SIBO is caused by an overpopulation of bacteria in the small intestine that normally do not form part of its balanced ecosystem. It can also result from overproduction of generally friendly bacteria, which leads to increased fermentation of sugars in the carbohydrates you eat. Other possible causes include immune deficiency, stress, certain medications such as steroids, antibiotics, and birth control pills, inadequate dietary fiber, and pancreatic enzyme deficiency. Comment below and let me know if you're suffering from SIBO and how you're trying to cope with it. What are the symptoms that can indicate SIBO? SIBO can be related to symptoms such as gas or abdominal bloating after meals, pain, constipation, chronic diarrhea or loose stools, signs of malnutrition and malabsorption, including weight loss and vitamin and mineral deficiencies, abdominal pain, mucus in stools, fatigue, nausea and vomiting. If you are experiencing these symptoms for a long time, it is important to talk to your doctor or general practitioner. You can also join my private Facebook group for SIBO. I will leave the link in the description below. What are some of the tests that you can undergo to diagnose SIBO? The most common and non-intrusive test to check for SIBO is hydrogen breath test. It is also called as lactulose hydrogen breath test. Lactulose is a non-absorbable sugar that's fermented. If there are intestinal bacteria, result in hydrogen production. If there's a bacterial overgrowth, fasting hydrogen levels will be high. In addition, after ingesting glucose, there will be significant rise in hydrogen levels. The conventional treatment for SIBO or small intestinal bacterial overgrowth involves a course of antibiotics, generally for 2 weeks. However, if you have allergies to antibiotics or if you do not want to take antibiotics, going through the natural route also is a solution. Please ensure you consult a naturopathic practitioner or a nutritionist so they can suggest the best treatment plan for you. It is also important not to self-prescribe yourself. Check out my website and download a free guide if you're dealing with chronic digestive issues such as IBS or SIBO. So how to treat SIBO naturally in 3 steps. Step number 1. Making changes to your diet. It is recommended to limit the intake of sweet and starchy foods when trying to address digestive disorders such as bacterial overgrowth. Restrict the consumption of grains, starchy vegetables, and some legumes that are harder to digest. Ensure you soak grains and legumes for a few hours before cooking. Unlike regular oils, which are harder for a person with SIBO to digest, coconut oil contains medium chain triglycerides, and is recommended for people suffering with bacterial overgrowth or malabsorption. Step number 2, the use of herbal antimicrobials. Here are a few antimicrobial herbs that can help with SIBO. Number 1, neem. The fruit, seeds, leaves, stem and bark of neem tree contain a huge number of phytochemicals. Neem extract has been found to kill many types of microbes. Number 2, oregano oil. The antimicrobial constituents of oregano oil kill bacteria by breaking their cell membrane. Research shows that oregano oil works to reduce different kinds of bad bacteria but leaves the good bacteria intact. Number 3, garlic. Whole garlic contains a component called allicin. It is known for antimicrobial properties. It also works to reduce candida or yeast overgrowth. There are other natural supplements like grapefruit extract, berberine, olive leaf extract that are also known to improve SIBO symptoms. Step number 3, rebalancing your gut. Using probiotics and digestive enzymes and vitamin supplements, you can rebalance your gut and improve the good bacteria. Probiotics are healthy bacteria that promote good gut health. Adding these to your diet using foods or as supplements can help rebalance your gut. If you're interested in finding the top probiotics that you can get from food, watch this video where I share the top probiotics. I will leave the link in the description below. Digestive enzyme supplements can support the body's digestive function. They should be taken before meals. Nutritional deficiency is one of the common problems faced by people with SIBO. It is important to eat healthy, balanced diet to get all the nutrition from food. Some of the vitamins that people with SIBO might be deficient are vitamin B12, magnesium, calcium, iron, zinc, copper, vitamin A, D, E, and K. Always work with a healthcare practitioner who can recommend the best treatment plan based on your symptoms of SIBO. So there you have it, the symptoms and causes of SIBO, the tests that you can undergo to know if you have SIBO, and the natural ways on how you can overcome SIBO without using antibiotics. I hope you can benefit from the information I shared in this video. If so, give it a thumbs up. Share it with your friends and family who might be suffering from bacterial overgrowth. Subscribe to my channel so you get notified every time I post a new video on a Friday. Thanks for watching. Until next time, stay healthy.